So I'd like to review the nutritional examination for the upper digestive tract. We're going to start off with the hydrochloric acid point. So we're going to find the tip of the xiphoid, and we're going to come down 1 inch and against the costal arch, not inside, but against the rib cage. I'm palpating with about 3 to 5 pounds of pressure, and I'm looking for sensitivity. So I'll ask the patient, is that tender or sensitive? The second digestive point that we look at is the pancreatic enzyme point, again finding the xiphoid process down 1 inch and against the costal arch on the patient's right-hand side. So that indicates the need for pancreatic enzymes, things like multizyme or enzacor. Thirdly, as we follow along the rib cage and come down into the Murphy's sign area, we're checking for acute sensitivity or acute gallbladder issues. I tend to palpate with a slightly heavier pressure in the gallbladder region, upwards of 8 to 10 pounds pressure. When this is acutely sensitive, you'll only be able to apply 1 or 2 pounds pressure before the patient starts to guard and show very acute sensitivity. When the gallbladder is a more chronic issue, this does not become as sensitive, but we tend to get more sensitivity down here at the ileocecal valve. The ileocecal valve, being the junction between the small and the large intestine, does respond to how effectively the patient is producing bile. So to find that ileocecal point, or that McBurney's point, it's about 1/3 of the way from the ASIS to the umbilicus, so about right there. The other thing that we find frequently with gallbladder problems is a sensitivity in the right thumb web. So that pinching pressure of about 2 to 4 pounds pressure should elicit some fairly sensitive or painful response from the patient in that thumb web. Not only is this diagnostic, but you can also use this to treat. So if you find a sensitivity or a tension or a tautness in these areas, you can gently massage that area while you hold the thumb point, or vice versa, you can massage the thumb point while you hold those tissues and feel for relaxation. So those are the common things that you'll see on a nutritional exam. The other thing that I find is if you were to draw a line from the xiphoid to the umbilicus at about halfway, this is also another point that I tend to see a lot when there's gastritis and or overt ulcers in the stomach. So while I think of Zypan and hydrochloric acid for this point, and I think of multizyme and enzacor for this point, and I think of beta food or AF beta food for gallbladder, whether it's chronic or acute. In this neighborhood here, this is where I'm thinking of things like Gastrex or ochrapepsin. Additionally, when you get some sensitivity that suggests maybe an ulcer or some gastritis and it's backed up by the patient's history, I also check this left thumb web, as that tends to be kind of a stomach reflex point on the left-hand side. So that's a good quick review of upper digestive functions and the products that you would use in that situation.